Hi, welcome back to the Gluten-free RN podcast. I'm Nadine, and today during episode 21, we will be discussing Parkinson's disease and celiac disease. Hi, welcome back to Gluten-free RN podcast. I'm Nadine, RN, BSN, CEN. Today, we are going to talk about Parkinson's disease and celiac disease. Number one, I came across a very compelling story with one of my clients, and also there's a lot of interesting overlap between Parkinson's and celiac disease, typically undiagnosed. We'll talk about that today. First, I'd like to give a huge shout out to all of the people that have given a review on iTunes for the Gluten-free RN. All seem to be positive so far, and I really do appreciate it because it helps other people find the Gluten-free RN podcast. And also, please feel free to refer to any of the podcast notes that are also associated with every episode of the Gluten-free RN podcast. I have a lady, and she's actually a friend of mine who I've worked with over the years. She lives in our town. She had been diagnosed with celiac disease as a child, so she was always sickly, and her parents had to have her on a gluten-free diet since she was a child. Very interesting history from going way back into the 1940s. So she did, in fact, have a diagnosis of celiac disease as a child. Leap forward to most recently, within the last 2 years, she ended up with a diagnosis of Parkinson's disease. So at that point, some of her other friends contacted me and suggested that perhaps I take a look at what was going on. So long story short, we ended up moving her out of her home into an adult foster home that, number one, fed all of the residents there a gluten-free diet, if not a paleo diet, and also a super good high-fat diet. So with any neurological issue, and certainly with celiac disease, most of us should be on a super good high-fat diet, and there's reasons for that. But on this specific diet for this woman, over the last several months, she got better. She got better to the point of her primary care doctor thinking that she doesn't even have Parkinson's. And she had very much the typical signs and symptoms of Parkinson's, which were difficulty walking, stooped gait, no real facial expressions, so a little bit of a mask appearance, and definitely tremors. She was falling, she had tremors in all of her extremities, all 4 of them, and she was having significant memory issues. She couldn't remember where she put her wallet, her keys. She had lost many, many things, including paperwork. She was hiding money all over her house. Very typical things of memory issues, early onset dementia. Some people would say Alzheimer's. I don't say that, but I would definitely say she was highly confused. So we got her into this adult foster home that fed her gluten-free and paleo, and she significantly improved. A lot of those symptoms went away. She ended up most recently doing Sudoku puzzles again, word puzzles, in an effort to increase her memory and her brain capacity. And it's quite a leap to go from confusion and can't remember your name to doing Sudoku puzzles. Can happen. So a lot of times, people, once they're fed the correct food, actually get better. What we did find is that she was getting gluten exposure in her own home, unbeknownst to her, and she wasn't doing it on purpose. But she was getting exposure to gluten from several of the products that she had previously been eating that were gluten-free, and then something changed, or she got the wrong package, or whatever happened. She was getting gluten again. In order to get her healthy and see what would happen, she did move into an adult foster home so that she could be watched and supported 24 hours a day so that she didn't fall. And during that whole process of changing her diet back to a gluten-free diet and putting her on a super good high-fat diet, she improved significantly to the point of now we're talking to her neurologist in order to wean her off of some of the Parkinson's medications. My educated guess is she really did not have Parkinson's. She had the neurological signs and symptoms of someone with celiac disease that was being exposed to gluten on probably a daily basis. So with the removal of the gluten, she improved. She got better. She no longer has what constitutes a diagnosis of Parkinson's disease. I highly recommend that anyone that has a diagnosis of Parkinson's or ALS or MS get tested for celiac disease before you do anything else. There's a good chance that a gluten-free or a paleo, which is what I recommend, diet change may help. Certainly get tested for celiac disease first as a baseline. And if you have celiac disease, great, because then potentially we can undo some of this damage strictly with diet changes. But even in the absence of a positive blood test for celiac disease, there is still non-celiac gluten sensitivity, which at this point is difficult to test for. There is no downside, and it is not dangerous to go on a gluten-free diet at the very least, and hopefully a paleo diet, both of which should include super good high fat in that diet. Your neurological system is essentially made up of fat. Your brain is a big blob of fat with a bunch of neurons running through it, and every nerve in your body is covered with what is called myelin. That myelin is made up of fat, and it's what insulates every nerve in your body. So when people have a disease which is called a demyelination disease or syndrome, that fat insulation goes away. We know that a lot of these issues are autoimmune, which means your body attacks itself. It's never a good idea, even on a good day, to attack yourself. Always be kind to yourself. And it certainly is not a good idea for your body to be attacking your neurological system. Please keep in mind that according to the University of Chicago, there is no published evidence of a connection between Parkinson's and celiac disease at this time. That's a direct quote from July of 2012. I think a better question as a nurse is to say, why is there no published evidence of a connection between Parkinson's and celiac disease? If there's no published evidence, it either means that there's not been any studies done or no one's asked the question. So I'm going to ask the question. If you are in a position to do a study on people with Parkinson's disease, perhaps that needs to be done sooner than later. And it's already later. What I've noticed in my practice and around my town in Oregon, and from all the people I talk to all over the world, is that more and more people are getting diagnosed with Parkinson's. Is this the new Alzheimer's where we don't really know what it is? It's a diagnosis of exclusion. People end up with these signs or symptoms, and if it's not anything else, then it must be Parkinson's. My recommendation for everyone that is diagnosed with Parkinson's or ALS or any type of demyelination issue of their nervous system, that they get tested for celiac disease first. The lab I would recommend people use at this point would be Cyrex Labs. The reason for that is that Cyrex Labs test for about 25 of the celiac antibodies or the gluten intolerant antibodies. But they also include the anti-tissue transglutaminase 2, 3, and 6. 2 is a general tissue transglutaminase. 3 is thought to be specific for skin issues. And the TTG6 or the tissue transglutaminase 6 is thought to be specific for the neurological disorders. So the Cyrex lab is pretty comprehensive. Please keep in mind that you have to get a total IgA and a total IgG antibody test in addition to the Cyrex Array 3. That test from Cyrex Labs, the Array 3, is a little expensive. Some people will have to pay out of pocket first, but your insurance company should cover that test. Any practitioner can order it. They just have to be set up with Cyrex Labs as an ordering practitioner. So nurse practitioners, physicians, naturopaths, all can order that test. And I highly recommend that all practitioners get set up to order that test because it is pretty comprehensive. It's one of the most comprehensive tests we have for celiac disease and non-celiac gluten sensitivity at this time. 30% of the newly diagnosed celiac patients are over the age of 60. Many of the people that I see for consultations are over the age of 60 and newly diagnosed celiac patients. Many of them have neurological disorders and have had neurological disorders for a long time. Whether that's neuropathy, headaches, migraines, seizure disorders, MS, difficulty walking, falling, balance issues. So a lot of my patients get better on a gluten-free diet. And really, if I have my way, which I sometimes do, most of my patients are on a paleo diet and some variation of a paleo diet, depending on their very specific issues. I'm going to mention narcolepsy at this point. I probably should do a whole episode on narcolepsy. There is significant evidence that narcolepsy genetically is overlapped with celiac disease. Like there's a genetic overlap between narcolepsy and celiac disease. Narcolepsy being when people fall asleep. They can be driving. So hopefully nobody with narcolepsy actually is driving. But I know that happens, unfortunately. There's a whole study that Stanford did several years ago on a family in our area because the entire family had narcolepsy. So they called it familial narcolepsy, idiopathic familial narcolepsy. But then they found out the entire family had celiac disease. So Stanford actually had to go back and amend that study and say, hey, now it's not idiopathic anymore. We know that they all have celiac disease. And once they went on a gluten-free diet, this family does not have narcolepsy anymore. Just compelling. Very interesting stories. That family runs a farm, an organic farm. They are completely 100% paleo, and they also have a roadside stand. So you can stop and get any of their organic produce, which I do frequently. It's called Midway Farms on Highway 20 between Corvallis, Oregon and Albany. I love supporting them as a family because they, number one, had to suffer for a number of years. Number two, they're fabulous people. And number three, their produce is amazing. It's amazing food. So I make sure that they get a lot of my money for the food that I eat. So again, I like to support local farmers. I actually bought half a pig. It's in my freezer right now from Farmer Dave, who I love. And that pork is amazing. We've already had a couple packages of that pork. And I have to tell you, it is amazing. So thank you, Farmer Dave from La Mancha Farms, for providing us with organic, well-raised, loved beef and pork, along with every other produce you can imagine, such as organic apples and hazelnuts. We love our farmers here in Oregon because they are amazing and provide us with organic, grass-fed, no antibiotic, no hormone meat, and organic, no glyphosate, no Roundup fruits and vegetables. Yum. So getting back to Parkinson's, it is becoming more and more common for people to get diagnosed with Parkinson's. And as a nurse, I have to say, what in the world is going on that so many people are getting diagnosed with Parkinson's? Well, if you remember during the neurological talk, I did talk about Dr. Hadjifasiliou. He is an expert in the neurological component of celiac disease. He lives in the UK, and all of his work is amazing. And he routinely tests people that have any neurological disorder for non-celiac gluten sensitivity and celiac disease. He is a big advocate for using the AGA, or the anti-gliadin antibody, as an excellent biomarker, if not for celiac disease, then certainly for non-celiac gluten sensitivity. Because even in the absence of celiac disease proper, a lot of these neurological patients get better on a gluten-free diet. And again, I would highly recommend a paleo-type lifestyle. At some point, there's damage done. I understand that, and I hope you do too. There's some damage done neurologically that is going to be difficult to reverse. But every cell in your body wants to improve. Every cell in your body wants to repair. And every cell in your body potentially can do that in the absence of the toxins or the neurotoxins, which gluten is. And then healing the intestines, eliminating the inflammation, and healing our immune system. During that entire process, what we're going to be doing is repleting all of our nutrients that have been deficient for a long time. And in the neurological component of healing, we want to make sure that we have a vitamin D level that is hopefully between 60 and 80. Oncologists like to see a vitamin D level between 60 and 80 because it's cancer preventative. But who goes to see oncologists? People that already have cancer. So I would like to tell you that it is cancer preventative to have a vitamin D level between 60 and 100. What's your vitamin D level? I highly recommend that people get that tested because it is an indicator of all of your other fat-soluble vitamins. If your vitamin D level is low, and I consider anything below 40 to be critically low, then we really have to look at fat malabsorption, healing the intestines, and then making sure that through diet and sometimes through supplements that you have an adequate supply of fat-soluble vitamins, A, D, E, and K, so that your body can repair. But vitamin D is noted to be the sunshine vitamin. Number one, it gets synthesized through your skin. So you can be out in the sun and your body can actually manufacture vitamin D. But for many parts of the world, we don't get enough sun. And it also has to be taken in dietarily. I myself take 5,000 to 10,000 IUs of vitamin D. Not every day because I don't remember it every day. But when I do remember it, I do take 5,000 to 10,000 IUs of vitamin D3. It's very difficult to overdose on vitamin D3, so if that's your concern, I would say do some research, and you will see that it's very hard to overdose on vitamin D3, and even if you do get it over 100, it's not that big of a concern for most people. It will come right back down. But the vitamin D3 if it's low, it's also an indicator that your A, E, and K might be low also. That's your connective tissue, your skin, your hair, your nails. How healthy are they? I see a lot of people and I always look at their nails. Do they have white spots? Do their fingernails crack? Do they bite them? Do they have hangnails? Your nails are very good indicators of your general health. And if your nails are poor quality, I would have to say you have to look at your nutritional level at that point. Do you have enough zinc? So I always recommend a zinc level gets taken with blood draw, and the vitamin D3, and also all of your B vitamins need to be assessed. B6, B12, thiamine. And if you want to do a lot more research on how to repair your mitochondria, on a cellular level, your neurological system, please look up Dr. Terry Wahls, Wahls. You can go and watch her TED Talk. You can look up any of her YouTubes. She also does have a book out called The Wahls Protocol. Again, it's Wahls, Dr. Terry Wahls. She was incapacitated in a wheelchair with MS, and she actually healed her neurological system so that now she's up, she's riding her bike, she no longer even walks with a cane, she is significantly better. And she's an MD, she's a neurologist, and she did this herself. So she wants you to feel better too. She wants you not to have neurological damage. Before I got diagnosed with celiac disease, I had what looked like MS. I was falling. I was 39, 40 years old, and that was very disconcerting. I didn't like falling while I was walking, certainly not tripping, but my kids actually noticed that when I was walking across our hardwood floors in our house, I would drag my feet. And even to the point of if I had my shoes on, I would leave skid marks on the hardwood floor because my feet would drag. Once I went on a gluten-free diet, I no longer had that foot drag, and I certainly didn't fall anymore. While I had signs and symptoms of MS that certainly could have been diagnosed as MS, I didn't have MS. I had deficiencies in nutrients, and once my body healed, once my intestines healed, once that inflammation went away, once I was absorbing nutrients appropriately, then I no longer drug my feet or fell. Again, that's very disconcerting. I didn't like the thought that I could just be walking and my legs would give out, or I would stumble and trip over my feet. My balance was horrible at that point, but over time it got much better. I'm no longer considered clumsy, where you drop things. Do you ever have those days when you just drop things? I was dropping things all the time. So it's considered to be clumsy. I don't have that anymore. Neurologically, my body is still healing, but significantly healed so that my neurological symptoms have gone away. I no longer have neuropathy or that burning in my feet. A lot of those symptoms that were attributed to other things have gone away on a gluten-free, now a paleo diet for the last 5 years. So please, if you have a diagnosis and you want to take medications or you have to take medications, I completely understand. But I want people to understand also that there may be an underlying cause for those neurological symptoms, whether it's MS or ALS or lesions on your brain, especially in the cerebellar region. If you look up celiac cerebellar ataxia, it's extremely well documented, and it's an inability to walk straight. It's an inability to walk in a straight line, and it's a balance issue. It's a proprioception issue. So sometimes those issues have caused damage that we can't reverse. But ideally, what we'll do is stop the damage from progressing and potentially healing that tissue, whether it's neurological tissue or the demyelination process, whatever it is. Hopefully we can arrest that damage and certainly hopefully prevent it from getting any worse. Throughout my research, there's a lot of people that have been in wheelchairs, have used scooters or walkers, have been bedridden, and simply by changing their diet, it's crazy, but it's true, they get better. Their symptoms get better, and they find they don't really have that diagnosis that they were told they have. So there is always hope. There should always be an option of going on a gluten-free or a paleo diet in an effort to stop the progression of some of these neurological issues. And I highly recommend, if you are in a position to do a study on a group of people that have been diagnosed with Parkinson's, that you do it. Set up that study. I will happily help in any way I can, but there's enough anecdotal evidence suggesting that Parkinson's is related to celiac disease or gluten exposure that it should be investigated. And I find it interesting that it hasn't been investigated. So this has been an interesting episode 21 of the Gluten-Free RN podcast on Parkinson's and celiac disease, a potential connection. Thank you very much for all of the support from Pulse Media Network and the podcasting guy, Tim Hallowell, an amazing group of people that help make sure that Gluten-Free RN podcast is the best it can be. Another huge shout out to all of the people that have watched my video on YouTube. I didn't even know it was up there, but it's Your Skin on Gluten from 2014. And at this point, well over 30,000 people worldwide have viewed that video. I'm hoping to get more videos up shortly, but right now that's a great video for people to watch. And I certainly appreciate all of the positive feedback from that video. If you have any questions or concerns, please use the show notes to find me. And thank you very much to all of the people that have reached out from all over the world. I'm getting lots of emails and Facebook connections, even on Twitter and Instagram, of people that are telling me their stories, which I find both compelling and sometimes tragic, but also very hopeful that once these people get the right information, their health will spin around in a very positive, healthful way. Thank you very much for listening to the Gluten-Free RN podcast. This has been episode 21, and I'm Nadine Gruskowiak, the Gluten-Free RN. Have a great day.